My name is Gianni Paneri.
My name is Phineas Grant.
My name is Elliot Schifferdecker.
My name is Ren Van Dorn.
I have struggled with my gender identity since I was, a young kid, and just feeling really uncomfortable in my body, in my interactions with people and how they perceived me.
Definitely had a lot of dysphoria, so I wanted to get the effects that testosterone brings, and like having top surgery, I really wanted all that so I could feel more masculine in my identity.
It was a mismatch of what I was taught to be and how I actually felt. I got a lot of encouragement and a lot of praise and a lot of attention for being tall and muscular and like handsome and all of those descriptors that I think people want their men to be. But I still couldn't look at myself in the mirror. I couldn't look at myself in pictures. I couldn't look at myself in the mirror. And despite everybody telling me like how good I looked, I still didn't feel comfortable. I felt a lot of shame.
I didn't really feel seen, and so I kind of felt like I experienced life through a glass, almost as if I wasn't there and just was kind of existing.
I was really anxious a lot. Like going out was like a big worry for me. Like I wanted to have fun, but you're wearing a binder and you're trying to talk to people. It was just very like stressful doing minimal things.
I started to actually understand my community, or understand myself and find myself a community. I'd be like, oh, that's why all of these things are connected. And my mental health started to get better, and then especially started to get better when I went on testosterone. I have a consultation for top surgery in June. Okay. It kind of got pushed back because they were like the soonest we could see you was May 18th, and I was like, oh, that's fantastic. And then I checked the day after, and that's when I graduate. So can't really do that. It is in Vegas because there is no one in Reno that takes my insurance, so that's frustrating.
I finally was at a point to where I was talking to my partner about it, and she is and was at the time as well a medical student, and she knew of a family medicine doctor at UNR that's amazing, and her name is Dr. Karen Thiel. She's the best. We went over all the different options, different dosages, and different types of blockers, and different methods of the estrogen, and we found one that worked for me. As far as facial feminization surgery goes, if I were to get one gender-affirming procedure, that is the one I would get. It's because I have very prominent facial features that are typically associated with being masculine. Because I went through male puberty, I have a more pronounced brow bone. I have kind of a more pronounced jawline, things like that. Like my face is overall somewhat androgynous, and HRT helps with that. But that is the one thing I would get, and I did go through the process of trying to get it covered by insurance, and it was awful. I'm currently not pursuing it because of that.
I'm pretty lucky that I worked at Starbucks, and they have people that will do that part for you. So even if my insurance normally, if I just had that outside of Starbucks, wouldn't cover it, they would do all that for you. So I did get a denial notice first, but then a week later I got an acceptance notice, and I didn't have to do anything. I definitely was bound to an organization that maybe I didn't want to be bound to, because they gave me that access that this bill would just give everyone.
My experience accessing gender-affirming care has been kind of a roller coaster. The hardest part is actually what I'm going through right now. I'm trying to access top surgery, and I'm currently in a battle with the insurance companies to try and get it covered. It's been a year trying to get top surgery.
I can't imagine living now, being out as long as I've been out and not being on hormones or having surgery. I don't know. There's definitely different ways you're perceived when you have those things.
For me, testosterone hasn't done an insane amount of change even after 2 years, but it just reaffirms my existence. I do have changes that I really like.
I can honestly say my outlook on my life has changed dramatically. I did not see myself living past 25, and here I am.
Trans people already suffer higher levels of depression, higher levels of suicide, higher levels of being unhoused, higher levels of addiction and things like that. So by not covering these procedures, you're actively harming these people. A lot of these people need these procedures to survive and to live their lives.
It's very difficult to go through this, and to, I guess, for people to not understand that the longer that I wait, the harder it gets for me.
I believe Nevada legislators 100% need to pass this bill.
That would just make it so much easier for trans people, like remove so many unnecessary barriers that we have compared to like cis people.
I'm excited to see what kind of trail this blazes for better legislation in the future.
Right now, this is incredibly important legislation. Obviously, it's been important forever. This is like healthcare for actual human beings. So, but right now, especially with lots of other states digging into anti-trans legislation, anywhere where we can get a step ahead of that is super important.
The way the country is right now, I never know when it's going to be taken away from me. So I want to get everything done as soon as possible, not only because of that, but also for my mental health.
There's going to be trans refugees coming to the states that they feel safe in and can get the care that they need.
We are not different to anybody else. We are not bad people. We do not deserve to suffer.
Nevada passed Senate Bill 163.
Nevada passed Senate Bill 163.
Nevada passed Senate Bill 163.
Nevada, pass Senate Bill 163. Trans folks deserve to live happy, healthy lives.